Hello, this is Chantal Machabée. I'm very happy to interview Shea Weber and Dr. Rajda for Hockey 911, a unique fundraiser for the Cold Life campaign of the Montreal General Hospital Foundation. Dr. Rajda, you're a member of the infection control and prevention team at the McGill University Health Center. Can you explain exactly what your work has been like since COVID?
Sure. Work has changed a lot since COVID has started. The infection prevention and control department's main job is to protect patients from acquiring infections while they are in hospital, but it's also protect the healthcare workers from acquiring infections while they are at work.
Yeah, how did this pandemic impact the day-to-day work in hospitals?
Things are not functioning quite as quickly as they were before. During the first lockdown, our activities were significantly reduced. Things are much improved right now, but we still need to take the time to do certain steps properly to make sure that everyone's safe.
It must be motivating to see professional hockey players showing their support to medical teams by contributing to important research projects such as the scuba mask project. Can you tell us a little bit about this great initiative?
Oh, the scuba mask project is absolutely wonderful. It's a great collaboration, and it provided a really rapid response to a huge problem in this crisis. So the scuba mask project actually provided the MUHC with a contingency plan. We were able to get our hands on these masks really quickly and begin a super rigorous evaluation. So we checked both the fit of these masks to make sure that there was no air leaks. We made sure that the filters that were attached to the snorkel portion at the top worked well and that they did their job. But even more interestingly, we also because we had them so quickly, we were able to subject them to various cleaning and disinfection methods. And this is actually a key feature of the mask because this makes them reusable, which makes the MUHC, should the crisis really ever come back, completely self-sufficient.
How important do you think philanthropy is in healthcare?
Oh, I mean, it's essential. With the help from our community partners and donors, both from the foundation and from the Hockey League, we're able to do this kind of work and these kind of research projects. We're able to do them in a timely fashion and really provide the comfort for our frontline workers to know that we have a backup plan, that they will be safe, and that we can continue to work for our community to keep everybody safe from COVID. So I think this is a huge thank you to the whole community, to the donors, to the professional hockey players. Really, thank you.
Thank you very much, Shea, for doing this with us today. Why did you get involved with the Montreal General Hospital Foundation and Hockey 911?
I think it's important to get involved in your community, especially with everything that's going on. And obviously, the doctors that we deal with do so much for us. I thought it was important to give a little bit of our time and give back in that way.
You have experienced quite a few injuries yourself in your career. What role played the medical team and doctors such as Dr. Mulder in your recovery?
They've always been great. Obviously, like you said, I've dealt with some injuries over my career, and they've been there and always there for good advice and helping along the rehab path or obviously in making decisions too with what you need to do going forward. And luckily, they've been very helpful for me and been able to keep my career going.
What would you say to hockey fans out there to help them go through this pandemic right now?
Yeah, it's tough. Obviously, it's tough on everybody, and we wish we were playing right now. Obviously, it's kind of weird to be in this situation in the fall not playing hockey, but everybody just got to stick with it, and hopefully there's better days ahead.
Yeah, and what would you say to hockey fans to encourage them to show their support to healthcare workers?
I don't think we give enough credit. I think, like you said, you don't see a lot of the behind-the-scenes stuff that they go through, the stuff that they deal with on a day-to-day basis, and us being able to talk to them and hear stories from them, we hear a little bit about that. So being able to give your support in whatever way you can, whether it's telling someone that they did a great job or giving back in any way, I think it's really important.